Welcome to Maddie's Monthly Behavior Connection, a monthly webcast where we learn about topics of interest to those of us who are interested in animal behavior, providing support to keep pets in homes or supporting pets while in shelter or foster care. Our guest today is Dr. Jill Sackman. Dr. Sackman is the only person in the world, I believe, who is both a diplomat of the American College of Veterinary Behaviors and the American College of Veterinary Surgeons. So a very unique individual. She's a graduate of Michigan State University College of Veterinary Medicine. She completed her internship at the University of Pennsylvania, her surgery residency at the University of Tennessee, and her behavior residency at Blue Pearl in Michigan. She's the owner and founding veterinarian of Animal Behavior Consultants of Michigan, a referral veterinary behavior practice with offices in Metro Detroit, Grand Rapids, and Traverse City, Michigan. Dr. Sackman is fear-free certified and sees dogs, cats, and horses with behavior disorders that range from mild fears to extreme aggression, compulsive disorders, and panic disorders. Dr. Sackman is also a certified professional trainer through the Karen Pryor Academy, earning her KPA CTP with her French Bulldog, Rose. Today, Dr. Sackman will be talking to us about assessment and treatment of hyperarousal behaviors in dogs. Welcome, Dr. Sackman.
Thank you so much. Nice to be here. I appreciate the introduction. I hadn't thought about being the only surgeon or behaviorist who's also a surgeon. It's an unusual combination, to say the least. I guess it reflects career life journeys I'm sure we can all relate to.
For
So
sure.
I am going to get started. Are we ready to get started with the presentation?
Yes, we're ready. You can go ahead and share your screen.
Get that going here then.
All right.
Make sure we ever looking good.
That looks perfect.
All right, so I'm going to be talking today about hyperarousal behavior in dogs. And it's an area which I feel like there's an increased focus and attention to, but really under-researched. There are a lot of different analogies to human behaviors, and we're going to talk a little bit about that in the introduction today. But I would say it'll be interesting to hear from the attendees, but in my practice, I'm seeing an increasing number of dogs with hyperarousal behaviors in my behavior practice. So I want to start off with talking about some definitions that I use, and realizing in the veterinary behavior psychiatry world, I'm starting to call myself a psychiatrist because I think that that reflects a lot of what veterinarians do. Who are veterinary behaviorists. The diagnostic criteria has not been well solidified, but I'm going to look at the literature. I'm going to share with you, based on the literature, how I use this language and what my diagnostics are. So you can relate to pets or dogs that you're seeing. I use the terminology hypersensitivity, hyperactivity, or HSHA syndrome. It was first defined by Dr. Patrick Piaget in 1998. So we look really to the French veterinary psychiatry or behavior community for some of the first definition and description. And this is the diagnostic or evaluation criteria that I use, is that which was originally defined by Dr. Piaget. It's described as being associated with impulsive, restless, hyperkinetic, hyperactive, and inattentive behaviors in dogs. And that has carried through in the literature with several other individuals you see going back into the late 90s up into the 20-teens. We're describing here a dog who is potentially a spontaneous model of human ADHD or autism spectrum disorder. And there is a lot of similarities. I don't want anyone to think, and I tell my clients this, that I'm diagnosing a dog that has ADHD or autism spectrum disorder, because those are truly human diagnostics or diagnostic criteria. But we have animal models. We have animals that display some of the behaviors that are neurologically very consistent with pieces of those behaviors So I feel like it often resonates with families really, really well when I use this language. And we're going to talk a little bit about some of the clinical presentation of humans with these neurodivergent behaviors. And I think we could talk about dogs as also being neurodivergent. And then there are a lot of owner-based questionnaires. Some of them relate specifically to the HSHA criteria. I bring that up because there may be those of you attending today that might be interested in using some of these questionnaires that help you work through what's going on with the dog. I'm going to go through the kind of classic presentation that I see when I see them as a veterinary behaviorist. It's also important to know that many of these high arousal, hyperactivity behaviors may be comorbid, meaning they go along with a variety of other behavioral challenges or disorders. I see frequently anxiety. I think this HSHA has a huge component of anxiety associated with it, which, by the way, so does autism spectrum and ADHD. And I will also see dogs with a suite of various aggressive behaviors as well. So you don't always see this as just the only thing going on. So just for an introduction, because I am going to use a bit of the analogy of the human, and I am not, obviously, Sheila didn't mention, I am not a psychiatrist. I didn't study this area. I attend enough meetings and I understand enough criteria that I feel like we have a lot of similarities to the dogs we see with these behaviors, and I wanted to go through some of those criteria. So attention deficit hyperactivity disorder, or ADHD, is often a lifelong and prevalent neurodevelopmental disorder in humans that's characterized by what is socially or situationally inappropriate inattention, inability to focus, hyperactivity, and impulsivity in behavior. And by impulsivity in behavior, I'm describing, and for a dog, what that looks like is I'll tell a family or a client that that's your dog has a very short fuse before they react. So they are constantly reacting to things in their environment without a pause. And that would be impulsivity in behavior. In humans, this is also associated with functional impairment, obviously in occupational and social domains, which our dogs don't necessarily. Although I suppose we could talk about training and family life for our pets. Inattention in humans is defined as relatively low ability to sustain a concentration on tasks, high distractibility, and what might seem to be a disorganization. So we try to think about these things in the context of when we speak about dogs. Hyperactivity is often characterized by an excess in motor activity, fidgeting, restlessness, difficulty maintaining stillness, and this has a very direct correlation to what the HSHA syndrome and what I see in dogs that I diagnose as having hyperactivity behaviors in my practice. I call them the perpetual motion dogs. They're bouncing. I will sit in a client appointment, and which might run 90 minutes or more for my practice, to get a full behavioral history and talk through what's going on in a treatment plan. And some of these dogs will have literally not paused the entire time they're in the room. 90, 120 minutes of just circling, bouncing off the walls, and high arousal behavior. So impulsivity is also characterized by a tendency to just kind of immediate urge, constantly responding to things that are happening into the environment. And this just failure of motor inhibition, this impulsive action, impulsive choice, and decision-making that goes on. So dogs, the domestic dogs, really have been identified as a promising animal model of neurologic disorders in other areas. And this is actually quite exciting. I know we're talking about today, and our main interest, and my main interest, is in helping these dogs and their families. But it is also, I think we'll learn a lot, let me just say that, about our dogs' behaviors, that animals that exhibit these behaviors, by dogs being models for understanding human disorders as well. And there's probably a continuum. It's very unlikely that human behaviors kind of come out of the blue. There's probably a continuum in the animal kingdom. So dogs have been studied for Alzheimer's disease, autism, and ADHD-like behaviors. And this proposed definition of HSHA covers these three main symptoms of hyperactivity, this perpetual motion kind of dog, a lack of satiety. That means the dog was just eating constantly. I don't see these always in my patients, but a substantial portion of them do fall in that category, where the owner will say, they're just gobbling food all the time, just cannot ever get to the bottom of their interest in eating. The other thing these dogs will often show is a much shorter sleep duration than normal cycles. And many times the family will say they might pause for 30 minutes out of 24 hours. I'm not sure when my dog sleeps is a very common description that I'll have clients share with me. So although HSHA is often reported by veterinarians as an ADHD-like syndrome, I think it's important that we remain clear that we're not diagnosing autism spectrum or ADHD in dogs. But when I tell clients, this is what your dog essentially has, it's the canine component of it, they often look relieved, because they'll say to me, oh my God, I thought that was what was going on. It reminds me of XYZ situation. And it seems like they often have a relief lifted off their shoulders, that they're not seeing something, this was somewhat normal behavior they're thinking, or something they caused. So just to reiterate, there are questionnaires that have been developed. Not all of them relate specifically to the HSHA syndrome, but are intended to help individuals evaluate these ADHD or impulsive behavior kind of components. So I'd encourage folks to look at those if you're looking at ways to start to create a list of ways to identify these specific dogs. I think once you see them and you understand what's going on, you won't really need a questionnaire. I don't need a questionnaire anymore. I kind of know just a few keywords. I can watch the pet in the exam room with the family, and I can figure out pretty quickly what's going on. But I've listed a couple of them here. There are others available, and sometimes those help. And I wanted to share just kind of one question list so you can see some of the questions. Many of these dogs have a difficult time learning because it's easily distracted. This is a matter of continuum, isn't it? And a lot of times what people will describe is like the perpetual puppy. But these dogs are generally in the adolescent phase, when you start seeing these really short distractions, inability to focus, absolutely stimulated by anything in the environment with an increase in hyperactivity. We start to go into kind of developmental. It's like a puppy behavior cranked up 100%. So they're really easy to distract. They lose focus. They are smart as whips. I tell you, I think these dogs are some of the smartest dogs I see, and I tell my clients that, but they're unable to focus long enough to actually execute on a task or stay on a mat or sit for longer than a microsecond before they're up and they're moving around again. So very difficult. A lot of times families will come in and say to me, I've gone to training classes and my dog can't focus on me long enough to complete a task. They can't sit longer than maybe brushing their tail on the ground and they're bumping right up again. It's often very hard to calm these pets. When I say calm, what happens generally is people try to physically or verbally calm the pet, and that has the actual opposite effect of stimulating more of the behavior, because many of these dogs, in my experience, have sensory processing sensitivity as well. So that would fall also under humans with autism spectrum disorder. They just don't seem, many of them, not all, many of them are very touch sensitive. They don't like a lot of hugging and touching, and the push off when they jump too much, or they're grabbing and biting and bouncing off the owner in just this incredible cycle. That what people do with that push off and voice tends to amplify more of the dog's behavior. So you see here a question, difficult or it's excessive and difficult control if the dog lunges and it's hard to hold back. So these dogs will be stimulated by such low auditory, visual, or tactile stimulation in their environment that their hyperarousal becomes high almost instantaneously. And how that translates for many of these dogs is jumping and grabbing and biting clothes, arms, bruises. Many of the clients I see, families with these dogs, have a lot of bruises and scars on their hands and arms, torn clothing, just by the hyperarousal behavior. Because I tell folks that's how dogs deal with hyperarousal. They jump and they grab and they bite. And it is not a fear-based aggressive bite, it's a hyperarousal bite. So also here you see always playing, always running, perpetual motion, zoomies all the time, reacts to just about anything in their environment, easily distracted, and just seems to have minimal to no impulse or self-control. So I think that description, is a really pretty good one, and it tips me off about what's going on with these dogs. So a little background on treatment, and I know that most of the folks attending today will not be prescribing medications. However, I think it's important to understand what we can do from a medication perspective, because I'm going to share with you data that I pulled cases from my practice to show there's some very effective treatment regimens that involve medication. And in some ways, I feel are more effective than using behavioral psychopharmacology or behavioral medications in, say, a very fearful dog, reactive dog. I feel usually when I meet with a client who has predominantly this HSHA behaviors, that dogs respond extremely well. And I'm actually more excited and encouraged we can get some than I would in many other circumstances. So in the human arena, methylphenidate was the first choice for attention deficit disorder. And the research focused on one of those neurochemicals in the brain that's absolutely critical, and that is dopamine, the kind of reward learning center. So they found that many psychostimulants also have a calming effect through dopamine, but they, through basic research in the rodent model, found that also serotonin was really important. This becomes critical when we think about treatment. So evidence has shown that using these rodent models, that serotonin is an important part of impulse control behaviors. And what we see neurologically with attention deficit hyperactivity, the physiology of that is very complex. It's probably multiple neurotransmitters involved, but the fact we also have serotonin involved as well as dopamine helps us figure out what we want to use from a treatment perspective. So methylphenidate has, in my mind, some real negative side effects or considerations if you're using it in a practice. One is it is thought to block uptake, make dopamine more available. One of the reasons it was used when these behaviors were initially focused with dopamine. However, if methylphenidate is a Schedule II drug on the list of how drugs with the potential for misuse are described. So to give you an idea, like Valium's Schedule IV, much lower. Schedule II means I have to write a prescription by hand, give it to the client. They have to take that paper copy in, and we have a very tight control. So that makes it always a little bit harder to manage. I will also tell you from my own experience, using methylphenidate is I've had a very inconsistent clinical response. So I was really at a position a few years ago where I wanted to look at alternative treatments, and I got really excited about this whole idea of using serotonin drugs. And that's actually what is described in a few of the research papers from the French and a few other veterinary behavior research. So when we think about management, and I'm going to kind of hang in here with me with the drugs, because I want everyone who's listening today to feel comfortable enough to say there are some effective pharmaceuticals that can be used, so you can be engaging a veterinarian in that conversation. Because I feel like if these dogs are primarily managed from a management and safety and behavior modification perspective, many of them will not make it because the behaviors are so significant. The high arousal, the grabbing and the jumping, and the physical trauma that the family is managing often make these dogs, they're in a position that they're often relinquished. So if you're seeing these behaviors, engage a veterinarian that you work with on getting the right medication in. So along with the serotonin drugs, which fluoxetine or Prozac is one, it actually is the one drug I find most effective in that family of drugs for these behaviors in dogs. It's often not enough for these dogs. And I started to use a different family of drugs in my practice, and I'm going to share the data for that with you in just a minute, that works a little bit differently and works in an area of the brain that decreases intense arousal levels through a different neurochemical called norepinephrine. Norepinephrine, think about fight, flight, boom, that explosive response. That's where these drugs work to blunt some of that effect. And the drug I use in dogs is clonidine, and that's also a drug that's used in people with PTSD. Imagine those individuals have this hyper response to a threat that's out of proportion to the immediacy of what's going on, as well as in children with autism spectrum neurodivergent behaviors. So it made a whole lot of sense to me that this would be a good drug to try. So a couple of years ago, a colleague of mine who in Michigan, I have a couple locations for my practice. My practice in the west side of Michigan, I work out of a friend of mine's training facility, Jen Gavin, and she said, because she sees a lot of these dogs after I start them on medication and get them down the treatment pathway, she'll see them as follow-up. And she said, you know, these dogs that we are seeing for follow-up training that have had a serotonin drug and clonidine are doing better than she had ever seen before, which kind of stimulated me, encouraged me to look at the actual data, which I'm going to share with you today. So the clinical data of the dogs I'm going to walk you through here came from predominantly my medical record system, and also from I share my medical records actually with my friend Jen, who's a CPDT KA certified trainer, and her practice, her individual practice focuses primarily or exclusively on dogs with behavioral challenges. So she might have identified some dogs, and we pulled those records, and they were treated perhaps by a referring veterinarian under my guidance or supervision. So we looked in the electronic medical records it's about a year, so 2021 to 2022, about a year in practice. The dogs that we had seen together, the dogs go through, I have a very consistent way I ask questions. So, as I was the only one diagnosing these, the dogs had a consistent diagnosis. And I think it's important to perhaps pull out in the way these dogs were treated, in the way I define as consistent with Dr. Piaget's description. So they do have really high arousal behaviors, but there are dogs that have high arousal behaviors that don't have HSHA. So you might have a high arousal dog that is just strictly aggressive. These dogs had hyperarousal because of impulse control issues. Okay. So all dogs that were in the group we pulled, the medical records, had been given behavior modification and safety plans as consistent with my practice, in addition to any medication. And they had a minimum of one follow-up within 6 months. Most of the dogs I see with this have follow-up longer than that, but to show kind of what change we could see within 6 months, that's what we pulled. All of the medications that were prescribed were listed in the medical records, so we looked at that as well. So we had it's really important with these pets that when you send them home and I talk people through what are we going to do, what is the problem, what am I seeing going on, and again, it's almost immediate when I start to see a young dog who has had minimal sensory input and has these high arousal behaviors that's leading to jumping and grabbing arms, hands, ankles, clothing, tearing clothing, bruising, a lot of times even biting, inability to focus. I have pretty much my diagnosis right there. But it's important when you send them home, because medication is not instantaneous in its effect, to have a safety and management plan. So these dogs all had an introduction to things they needed to do with regard to management of the environment and training alternative behaviors. So you might think, gosh, these dogs really, let me pause for a minute here, because I do feel many times when these dogs have been seen by either a veterinarian who does not have a background in behavior or experience in behavior, or a trainer likewise who doesn't have a background and experience in behavioral consultations, they'll see these dogs and the recommendation to the family is more exercise. And I can guarantee you these dogs with more exercise will get worse. So I think the first thing which helps relieve a lot of the family's distress, as I say, this is not going to be solved by increased stimulation with exercise. What these dogs need is more ability to relax and refocus. So we take a lot of that off, but a lot of the times these pets are not able to work on a relaxation protocol, which requires focus and impulse control as part of that. So I want to send them home with safety, things that'll make sure they're safe in the environment, and starting to teach the dogs some things that will build impulse control. And one thing that Jen usually uses, and I use as well, is something she calls a Zen Hands. You may recognize it. I've had other people tell me like, oh yeah, I know that, but I didn't know by that name. But it's basically getting the dog with its treat in your hand to back off and back away, and then almost using this hand signal like this or like this as the signal to back away from you instead of jumping and grabbing. And we are going to play. This is Jen Gavin in her practice, A Pleasant Dog in Grand Rapids. She is going to demo this behavior of the Zen Hands with a dog she has been seeing, we've seen mutually, that has HSA syndrome and has been on medication.
Hi there, I'm here with my friend Scarlett, and I want to talk to you today about hyperarousal. And hyperarousal is something that I liken when I'm chatting with clients to ADHD in humans. The clinical signs or symptoms that I see of hyperarousal in my practice are jumping, mouthing, sometimes hard enough to break the skin or even puncture the skin, a low tolerance for frustration, so barking, getting really frustrated when a treat doesn't come fast enough or when they're not released fast enough to go see a friend or a loved one, jumping, knocking people down, tearing clothing. And Scarlett initially, yes, presented to us for training because of those symptoms. So jumping, barking, grabbing, yes, mouthing, breaking the skins, pretty significant hyperarousal, and she has been treated by her referring veterinarian with fluoxetine for about 4 to 5 months, and she has what I would consider to be a partial response to fluoxetine. She right now, today it's 3 o'clock at our school for dogs. She's been here since 8 a.m. She's had multiple long play sessions, and you can see that she's still pretty, yes, feisty. When I'm not actively working her, she's climbing the walls in here. She's jumped up. I've got a little bruise on my hip already, and we've been working together for like 5 minutes. So I want to show you, yes, some of the things that we do to start to teach replacement behaviors for some of those symptoms for separation, or forgive me, for hyperarousal. So one of the things you'll notice right away, yes, is that Scarlett has learned that I really like it when she sits. That is something that I can use as a replacement behavior for jumping, and I'll often teach clients, provided, yes, there are no structural issues like hip dysplasia or any other kind of orthopedic issues that might make sitting uncomfortable. I will counsel clients, yes, to teach sitting as a form of saying please. So ask your dog to sit before feeding them their food bowl, before something good happens, like going outside, so that we begin to get this nice sit behavior. Another thing I like to teach is something we call Zen Hands. And I'm going to show you as if she didn't know this, but I think of Zen Hands as a physical cue for a dog to back up. Kind of, I tell my human clients it means that yes, human hands are sacred, and I'll often use this to teach dogs to back up when they're jumping and breathing or mouthing or even herding nips that happen with dogs when we're moving. So to start this behavior, Scarlet, yes, I'm going to start with a treat in my hand, and every golden retriever or other dog is going to want to sniff that. I'm going to close my fist over it and allow her, yes. As soon as she moves slightly back from it, I'm going to mark that moving back, even if it's a half of an inch, with yes, and then I'm going to treat yes. And you can see with practice, she begins to, yes, sit proactively when she sees that fist. As she gets better at this, then I can begin to make it harder by getting excited. Yes, and still offering that Zen fist so that she backs out. Breathe, Scarlet. Yes, good girl. I'm not requiring a sit. I'm only requiring that she move her body back. Yes, but because of our long-standing work together, Scarlet has started to offer this. Once this is going well in our school for dogs, then we start to ask for those same behaviors at home and in increasingly exciting circumstances. And this for me, when I see dogs, yes, respond well to this, as Scarlet is doing today, I believe that that means we're on the right track treatment-wise. If, however, I see a dog who, despite really concerted efforts by the owner and trainer, whoever the training partner is, still continues to struggle, and if there's even the slightest amount of excitement, is still grabbing hands, biting hands, tearing clothing, jumping up, yes, then I would say, oh, we probably need to send you back to our veterinary friends to see, yes, if there's something else we can do treatment-wise to keep that dog able to think and to not be overflowing with emotion in those circumstances. Thanks for watching.
Okay, and I am now going to show another short clip where Jen is demonstrating this with a child, her son, because many of the greatest challenges are when the family has young children or below 15, 16-year-olds in the home. So that age range where there's a lot of activity, a lot of physical contact with the dog, a lot of noise in the house, and the child is often the individual that is receiving the most of the jump and grab behaviors. And in fact, by the time I see these families, there's a child often that says, I didn't want to be around that dog anymore because they have knocked them over, they have bitten and grabbed and torn clothing because of the high arousal behaviors. So I'm going to show Jen demoing this with a child, her son.
Hi there, I'm working with Ruthie, named after Ruth Bader Ginsburg, and Ruthie has, yes, a little bit of trouble not getting excited when she sees people, whether they're people she knows or people she doesn't. We call this, yes, hyperarousal in dogs, and it's similar to ADHD in kids. Yes. And one of the things we like to do in these instances is to teach dogs an alternate, yes, behavior instead of mouthing or jumping. And with Ruthie, we are teaching her, yes, an activity called Zen Hands. In this activity, we practice putting our treats inside of our hand and we make a fist. When Ruthie comes, yes, to go sniff those, we wait for her to back up, yes, and then we yes and treat. When I send that treat, yes, I am throwing it on the floor because I want her to not get confused and understand, yes, that the treats don't come out of my hand. Yes, and you can see she's been working with us for a while and she's offering me some nice sits. I have a helper today in my office. This is my son Milo, and we are going to work with Milo, yes, on getting the same results. So we're going to start at first with Milo just sitting right on the couch there, and he is tired from a long day at school. And I'm going to have you put these treats in your hand, and then you're going to make a fist. And when Ruthie comes up, you're just going to hold your fist. Yes. As soon as she backs up even slightly, you're going to say Y-E-S and then toss the treat at her, okay? So sit up and show her you've got a treat in your fist. Good. Just hold your fist out straight. Good. Now throw it. Good job. All right. And you can see that's kind of hard for kids. So for the next round, I'm going to kind of puppeteer my hand over Milo's. And you notice that when she approaches, I'm pretty quickly luring her back. Yes. Milo, come over here. I'm going to have you give me your hand and your fist. And then we're going to hold out your fist. Just hold it still. Yes. Now toss. Good job. Let's try that again. Good job. So again, try not to move your hand back when she comes up. So I'm going to put my adult hand over my son's hand. And he's going to hold that out. Yes. Toss. Good job. All right. Do you want to try one without an adult hand?
No.
Please. Okay. Call her name. Good job. Now hold it. Yes. So she sat. That's beautiful. You're going to say yes and treat. And you notice with a teenager who's a little tired, he's maybe not wanting to participate quite as much. Yes. So I can, as the adult, yes and treat when she backs up from him and toss that treat. Yes. The other thing I'm doing is that when she notices a distraction, and that distraction could be a person that she's excited about, yes, or something in the environment, yes, I'm also yesing and treating her for noticing that. And we are going to go do that out in that outdoor environment next, and we will show you how that looks. Thanks for watching.
All right, we're back. The results from, so the dogs that were in the study had that sort of follow-up, additional to safety, just things that we think there was some text at the bottom of one of the videos is how we also identify safety gates, places where family member children are able to get behind a gate, close a door from the dog. I often talk about the dog needs a sensory timeout zone, very much like an autistic child would need when it's just the world is too much, which is causing that whole sensory arousal level. And I want that dog to be able to go to that space, be quiet, and the family members to be safe. So we go through that and we identify those areas in the home as well. We had in that year-long medical record poll, retrospective poll, we had 56 dogs that were seen and treated during that study period. It's a pretty even split between male and female, although the two videos show golden retrievers. I will tell you, I see this in any dog, any breed of dog, male or female, any breed. I will say one thing that I am starting to record going forward about a year ago is early life history, because just anecdotally, I will say that a greater percentage than 50% of these dogs have some recorded history of early life, either maternal trauma, maternal loss, early separation from their mother, huge litters where they've been bottle raised. So I really feel like there is some early developmental component to a genetic predisposition in these dogs. So most of these dogs that we pulled records were either neutered or spayed at admission. A third were less than 1 year of age. Almost half were between 1 and 3 years of age, and 20% were over 3. And I really am amazed by these folks at over 3, because the vast majority of these dogs start to show this behavior at about 6 months of age. So those families have been putting up with a lot of very challenging behavior in the house. So as I've described, primary behavior problems presented with the high arousal, including the jumping, grabbing hands and arms, and hard biting many times. This isn't a friendly bite. It is not it's really important to differentiate between a dog who is biting because of a fear-based aggressive behavior and a dog who has hyperarousal. But I will tell you, the bites can be just as hard. They bruise and they break skin. And many times by the time I see the pet, the family is just about done with being able to live with the dog in the home. They grab and tear clothes. They'll grab ankles and shoes with walking. That motion is part of that hyperarousal behavior. jumping, lunging, barking, knocking people over, all with what we would say is fairly limited environmental stimulation, which can include petting and rubbing by the family. It can include auditory, that what they're hearing, and also visual stimulation for these dogs. Many of them had difficulty sleeping and resting. The clients would describe them as a perpetual motion. And some, but not all, had lack of satiety, just this ravenous appetite. But that's probably the one clinical feature that I see the least consistency is the issue with satiety. So all of the dogs starting at or under 4 months of age started to show these behaviors. So you can see when I saw them at over 3 years, these families had been managing this somewhat unsuccessfully for a very long time. We had a lot of other behaviors concurrent, or what we call comorbid, with the hyperarousal, which can get a little tricky as far as what's causing what, such as fear-based aggressive behaviors. 40% had resource guarding aggressive behaviors, territorial aggression, conflict aggression. Conflict aggression is, we would describe the dog is using its teeth or aggressive behaviors to limit interaction generally with the family members, such as touching, petting, husbandry care, those sorts of things. And there was also a percentage that had noise phobia, separation anxiety, generalized anxiety, compulsive behaviors as well. So it's quite frequently you'll see other behavioral signs with the hyperarousal. So what we really were looking at was how effective were these dogs' behaviors managed with the use of clonidine and an SSRI. The about 45%, so around about a half of the dogs that we saw had not been on any behavioral medication or intervention when they were first seen. 11% had been on fluoxetine, which is a serotonin boosting drug alone, trazodone alone, and the remaining percentage of dogs were on a combination of other serotonin boosting drugs, other SSRIs with and without trazodone, various supplements. About 5% had been on a variety of non-prescription products. After admission, 13% of the dogs were started on fluoxetine alone. 55 were put on fluoxetine and clonidine together, and the remaining were started on clonidine in addition to what other SSRI or serotonin drug they were on. And that decision was made of how well managed that dog was in the home. And I like to see response to fluoxetine first before I add clonidine, because some of these dogs will respond okay with just the one drug. If the dog had already either very significant behaviors, very challenging behaviors in the home for the family, and we'll start them on clonidine at the same time. Okay. So results with the medication regimen and the treatment regimen that behavior modification and safety we've described. 80% of the dogs had a recheck in 6 months. 47% had no side effects. The remaining had a very transient side effect. It's pretty common when you start fluoxetine to see some mild reduction in appetite, generally related to food palatability. Less common in my experience, agitation or lethargy. These are generally self-limiting and resolved over a short period of time. And at 6 months, 86% of the dogs had behaviors described by their family as improved to greatly improved. 14% thought there were minimal improvement, and only one dog was felt to be worse. Okay, so pretty substantial improvement in behaviors with these dogs. So conclusions here. Pretty strong evidence, I feel, preliminary results that SSRIs and clonidine has really been effective for treating the high arousal behaviors and have pretty minimal side effects. And most clients noticed a significant improvement that allowed these dogs to stay successfully in the home. So allowed the dogs that might have been, I'm often told by families I'm the last stop before relinquishment or behavioral euthanasia, which I wish I could see people earlier, dogs earlier. But many of these dogs I will see for years and consistently stay in the home. Are the behaviors absolutely gone? No. But are they manageable? Absolutely. The dog's attention has improved. And I think most importantly, the safety and management of the dog has improved. So we've eliminated the biting and the fear of being knocked over, injured, and clothing damaged. Okay.